Lieutenant General Russel Honoré. He's perhaps best known for serving as the commander of the Joint Task Force Katrina, where he was responsible for coordinating Katrina-affected areas across the Gulf Coast as related to the military. He has been critical of the government's response to the coronavirus pandemic. He joins us from Baton Rouge. Do you remain a critic, General, or have things improved?
I do remain a critic because I know we can do better, Larry.
Where are we failing?
Well, number one, in issuing decisive guidance to the states, we knew from day one the technique or tactic we should be using is people staying home, and we've selectively used that across the state, left it to the governors, and we still have some 10 states still not practicing social distance. We knew we were going to have a logistics problem and that we did not have enough equipment to give to the doctors and to the hospitals, and we still haven't fixed that problem. And from the perspective of how we're managing that logistics, I learned a long time ago that the way you deal with a disaster is through logistics. And our logistics setup, after weeks, only like 12 days ago, they gave this to FEMA to try and support the governors. And the procurement cycle we're using is just effective in that we've got states competing with federal government. So those were the big ones, the messaging on what we wanted people to do and when we wanted to do it. And then the idea of not having the test and claiming we have the test and we don't have the test. And we know the test is key to identifying people who are asymptomatic, those that are ill, and to protect the healthcare workers. And we still don't have testing straight. I said one, test, get the logistics fixed and straighten up the messaging. And this has been going on now for about 4 weeks since I did my first interview about this, Larry.
Is the military sufficiently involved, in your opinion?
We're getting there. The strength of the military in an operation like this is command and control and logistics management. The government decided to give this task to FEMA, and they're not a logistics organization. They write checks. But we do logistics 24/7 around the world. And I've coached from day one that this management and tracking of the equipment should be the military channels using the logistics agency. But they didn't go that way. They went to FEMA and now together a ad hoc group to try and meet the needs for medical equipment, PPE, and ventilators.
Besides the media, has anyone in government reached out to you for any help in this?
No, I do my messaging, whether it's an interview once or twice a day, or I tweet the White House and all the agencies, and I have a feeling they're listening because I see within a couple hours some of my words coming back at me. I do want to say the bright spot on the other end of this is the sacrifice that our first responders, the people working in the hospitals, the nurses and doctors, and the hospital staff across the board, they have shown much courage, and they will have to deal with the majority of the real ugly part of dealing with this pandemic as they lay witness to our people dying in the hospital who cannot recover from this very bad virus.
Lieutenant General, what's the situation currently like in Louisiana?
Louisiana is bad and getting worse, Larry. It's going to get worse before we get better. the numbers every day, the number of people dying and the one being admitted, because the first test we did 7 or 8 days ago, and it's been taking that long to get the results back, drive up the numbers of people that's been certified as having the virus. Unfortunately, it takes about that amount of time from people are tested till the time they go in with what is initially described as double pneumonia. Then they are certified as having the virus. And the ones that are healthy enough, they're surviving. And the ones with secondary conditions, they're not surviving. Those with diabetes, elderly, obese, or having heart issues. It's hard for people with those conditions to survive.
All right, what would you say in this time of peril, and there's no other better word for it, and you handled Katrina so well, what would you say to Americans now watching and others around the world? What advice would you give? What thoughts do you have?
Number one, I think the way we're going to work our way out of this is each one of us need to assume we have the virus, and everybody you meet have it, so that social distance work, and accept the idea the only one going to save us is us. There are no jet planes to attack this enemy. There are no bombs to drop on it. It's the actions of the people is the most effective way to stop this virus from attacking one another. And practicing the issues of social distance, washing our hands, not touching our mouth. And we do need to wear a mask. For a damn month, our own people, CDC and Health and Human Service was telling us, oh, don't wear a mask, don't worry about it. At the same time, when we see the effect the Koreans and the Singaporeans have with everybody wearing masks and the Chinese, now it might be a good idea. Everybody needs to get on board. Because if every state don't try to use this social distances now, stay home, wash your hands, wear a mask, and follow the old tactic. Assume you got it and assume the other person has it. And that is the only way we're going to stop this virus from attacking us and our friends and our family. But we can get past this, but it's going to be the actions of the American people. It won't be based on what the government do. I can guarantee you that. Everything the government is doing is people already. What the government could have done early on was to give us early warning, did not treat this like a political hack job, and be straight with the American people. It's a replay of what General Wilson, President Wilson did in World War I to see it happening today.
Thank you, General. Wise words as always. Thanks so much for being with us.
And it's good seeing you again.